From the Toronto Star, I'm Raju Mudler, and this matters. We all know what it's like to be sick of work, but what happens when going to work makes you sick? A meat processing company, a skincare product manufacturer, and a circuit board maker are three of the first employers the Toronto Public Health Authorities have named because they have COVID-19 outbreaks that pose a significant public health risk. Sofina Foods, Decium, and TTM Technologies are those three companies, and the fact that we can name them is the news. Worker advocates and health officials have long been calling for more information about where workplace outbreaks are occurring. And from now on, Toronto will be sharing that information with the public. But there are many places across the province that still won't. Sara Mojtehedzadeh is the Star's work and wealth reporter, and she has been following the story since the beginning of the pandemic. And she joins This Matters today to talk about what this decision means, how it can help essential workers, and what it can tell us about how the virus is spreading in workplaces. Sara, thank you so much for joining us today.
Thanks for having me.
So, Sara, let's talk about this news and this just announced change in policy. Toronto authorities will now start naming employers with significant outbreaks. What exactly does this mean, and what information will we be getting?
Yeah, so this is a significant break in the convention over the past, 10 months of the pandemic, where previously Toronto Public Health Unit was not naming employers with significant outbreaks and wasn't providing even really detailed information about where exactly workplace outbreaks were happening. So starting this week, they will start providing the public with that information. So they're now listing specific employers who are seeing workplace outbreaks that pose a significant risk to the public. And they're also providing more detailed reporting on what types of workplaces are seeing outbreaks. So they're providing 11 sectors and the number of outbreaks in each sector, which really gives people a sense of sort of where the risks are and what kind of workplaces and services are seeing the greatest COVID risks.
This is information that workplace advocates and even the Board of Health has been asking for a while. Why wasn't it being shared or tracked? And then I guess the other question of that is when it has been, it's been pretty haphazard. What's been the issue with getting this information out to the public?
Yeah, it's been a source of, I think, concern and frustration for a lot of people really since day one of the pandemic, because experts have been saying since the very beginning that essential workplaces, particularly low-wage essential workplaces, are at greater risk of COVID-19, and that in turn poses a public health risk to everyone else. And so the conditions inside these workplaces are important to the workers, obviously going into work every day, but also to the entire city. But what we were finding is that the reporting conventions across health units in Ontario is really inconsistent. Some health units started early on providing at least some high-level data on occupation and some workplaces that were having outbreaks, and others just would not name any employers, citing privacy reasons. And the privacy concerns were really kind of the major explanation whenever you got in touch with the health unit asking questions about specific workplaces. That was the response you would typically hear. And so, earlier on in the pandemic, for example, we reported on a massive outbreak at a Toronto bakery where over 180 workers got sick, but, it wasn't reported by the health authorities. And so from the beginning, there have been questions around whether that makes sense. And I think that, typically in an infectious disease situation, you do need to balance the privacy concerns of workers who may be impacted, bearing in mind that there is a stigma often attached to infectious disease. But what health authorities and health experts are saying is that in the context of COVID, that logic doesn't make sense anymore because there is a broader public health risk to workplaces that are seeing significant outbreaks.
I think you and some of our colleagues like Jennifer Yang, Kate Allen have done, making Ovi as well, great work on talking about essential workers and how they are at risk during this pandemic. A recent report from the Ontario Health Coalition said that the outbreaks far outpaced that of the general public. Can you talk a little bit what kind of numbers we're talking about when we're talking about workplace outbreaks?
Yeah, so there was a report recently from the Ontario Health Coalition, and it looked at 2 weeks worth of COVID data from mid-November to the beginning of December. And it found that cases in the manufacturing sector were far outpacing the general population. So amongst the general population, cases were going up by around 22%. And in manufacturing, that number was 77%. So the data is really bearing out that workplaces, especially these kind of essential, often fairly low wage and precarious workplaces, are a significant driver of COVID transmission. And when you look overall at the provincial COVID data, you see that workplace outbreaks are the second highest source of cases behind long-term care settings. So there's ample evidence to show the importance of focusing on workplaces and workplace protections and workplace safety as a key part of how we are dealing with COVID.
Let's talk about generally what industries are having outbreaks. And then I want to talk about a little bit more specific, as you've reported some very specific stuff. But generally speaking, what are we learning from this information right now? And I guess where are the hotspots?
Yeah, so in October, I had actually requested data on this from the Workers' Compensation Board just because of the lack of transparency from health units. So we're really looking for any source of information to help paint this picture. And what that showed, and I think remains true today when you look at the more detailed breakdowns that are coming out, was that, of course, healthcare workers are at significant risk, huge impact to workers in that sector. But also, agriculture was a huge one, farms and food processors was a huge one. And these are obviously essential workplaces where, folks don't have the ability to work from home and whose work, the rest of us rely on. We're also seeing outbreaks in the warehousing sector. And I think the common theme here, again, is really these are settings where work from home is not an option, where often the nature of the work makes physical distancing hard, and where workers often don't have access to paid sick days. And I think that's a huge one as well. My colleagues Jenny Yang and Kate Allen have reported on the high number of cases in Peel region and finding that I believe it was 80% of low-wage workers in Peel didn't have access to paid sick days. So, these factors are all sort of playing a role in which sectors we're seeing significant outbreaks.
So from this new information, we have also some very specific places. There's a meat processor, a skincare manufacturer, a skincare makeup manufacturer, circuit board maker. You've also reported on outbreaks at Amazon warehouses and, of course, the industrial bakery that you mentioned. Let's just start there. This tells me that this is basically regardless of industry. And then I think the next step is how does having this information help the average person?
Yeah, you're right. It's really all kinds of workplaces are seeing outbreaks. But again, I think that there are some common themes in the places that I've reported on, whether it be, the sector or the specific workplace. And again, it comes down to workplaces where, you obviously have to go in to make the thing that is often being produced or manufactured or distributed. And the nature of the work makes it difficult to socially distance. Workers are often fairly precarious to varying degrees, but often on the lower wage end of the spectrum. These are sectors also that often do rely on temp agency workers. And so you may have workers that are actually juggling multiple jobs still, which again, we know is a higher risk factor during COVID. So while it is impacting so many different workplaces, those are sort of the common themes that unite many of the workplaces that I've reported on.
And then how do you think these new rules can help the average person in terms of the information and the transparency?
What we heard really strongly yesterday from the Board of Health and from the health unit was that information is power. I think, first of all, it empowers workers to know what they are getting into when they turn up on the job. And, worker advocates have been arguing for months that every worker deserves to know the risk and hazard that going to work every day might pose to them and their family. And that's a key part of workers also being able to, do their best to keep themselves safe on the job. But I think it also helps the public because in the absence of accurate information about where the risk is, it's really difficult to gauge your own risk, when you go to the grocery store or whatever other decision you're making. I think that over the first part of the pandemic, there was a lot of fear about, going to the grocery store or, making these really basic decisions. And, we are seeing workers in those retail sectors get sick. But I think what the data shows is that the bigger risk is in these kind of industrial settings that are often invisible to us as consumers. And so I do think that helps people with their risk perception and also helps policymakers, target their decision making to respond to what the data is showing.
We'll be right back. The other big part of this is enforcement. And from your reporting, it doesn't sound like that's actually very much of that's happened. I think you've written like 2 companies have been charged so far. This is something that also needs to be beefed up as part of this, right?
Yeah. And this is, again, part of the new measures that were announced by Toronto Public Health on Monday. In addition to the added transparency, the health unit said that they will be beefing up safety precautions that they require employers to comply with, along with stronger reporting requirements. And they are now conducting joint health and safety inspections with the Ministry of Labor. But, enforcement of workplace safety does really reside with the Ministry of Labor at the provincial level. And there have definitely been questions around whether the Ministry of Labor has been given a robust enough role in all of this. One of the main lessons from the SARS epidemic was that the Ministry of Labor has a crucial role to play in enforcement and infection control activity. And what data we requested showed was that since the start of the pandemic, the ministry has fined actually just one employer. It's also issued one fine to a worker for failing to comply with health and safety requirements, but very little in the way of ticketing and serious prosecutions. Actually, no serious prosecutions launched by the Ministry of Labor between March and December. And that has certainly caused concern amongst worker advocates who say, especially in these precarious workplaces, it's very difficult for workers to speak up about safety concerns, and they really rely on that proactive enforcement from the Ministry of Labor.
I think the other flip side we should say is right now, this is just for Toronto, right? We've already talked about how other public health units report this differently. So we're not going to get a whole picture across the province, right?
No, this is Toronto only. And again, I think that is a concern for worker advocates because we do know that actually a lot of the workplace outbreaks are happening in regions like Peel, which is where, a lot of warehousing, shipping, manufacturing, industrial work is concentrated. And so those advocates really want to see other health units follow suit. Another sort of hotspot is, of course, the Windsor-Essex area where there have been so many agriculture outbreaks, more than 1,500 migrant workers impacted by the virus. And so the transparency piece at this point is still really incomplete. And Toronto is sort of the first unit to take a step in this direction.
I think you already mentioned it, but I think it's worth saying again. What more do we need to do for essential workers? Is it paid leave, and is it a place where they can go when they are sick? Are those the two main things that advocates are calling for?
What was interesting about the health unit's announcement on Monday was that John Tory really had some strong words for the province on those bigger workplace protections, the city can really only do so much because a lot of the responsibility and power for workplace safety does lie with the province. So the city of Toronto, as well as the other mayors in the GTA, have called on the province to step up workplace inspections. They have called on the province to implement paid sick days. And John Tory said on Monday in no uncertain terms that he is not happy with the response or lack of response from the province on that front, and saying it's past time that they act on paid sick leave. Mayor Patrick Brown in Brampton as well has called on the province to up workplace inspections and is calling on his own health unit in Peel to follow suit and start releasing the names of workplaces with outbreaks.
Sorry, you've been following this story for the entire pandemic. I think people have been asking for this information for a long time. What do you think about the fact that this is finally happening now and we're getting it? Is it because the numbers are just so bad that they have to sort of get information out? What do you think is motivating this?
I think it's probably a combination of factors. I think there has been some strong reporting showing the gaps in transparency, and I think that has, spurred some action. I think that the data that we do have doesn't lie. It shows that workplace outbreaks are a significant public health risk. And I think it just has become harder and harder to excuse, the lack of transparency around this. And so I think, there's pressures from so many different angles. And on Monday, Joe Cressy said that the story of the pandemic is really a story of work. And I'm biased because I'm a labor reporter, but I really think that's true. Even in long-term care settings, an absolutely sort of devastating story of our elderly citizens' treatment and vulnerability to this virus, that too has a labor angle. The long-standing precarious working conditions in the healthcare sector, we're really seeing the impact of that. Our elderly citizens are the ones who are paying the price in many cases. So, I think the pandemic has really shone a light on why working conditions are a public health concern. And that's something that experts have been saying for years. It's not new information, but there's just no way, I think, to ignore it anymore. And I think we're seeing that in the policy decisions that are now being made.
So, big question, what do you think should happen next? Or I guess, what do you think will happen next?
I think the pressure around those provincial protections that would impact, not just Toronto workplaces, but workers across Ontario is still the big unknown. I don't know if we'll see action on that front. I think that the Ford government reversed some of the protections around paid sick days that were implemented under the Liberal government, and they haven't so far shown any indication that they're willing to revisit that decision, despite the sort of pressure that's being placed on them from leaders at the municipal level and worker advocates. I think that the Ministry of Labour has conducted a lot of inspections in workplaces. I think the question will be whether they ramp up the enforcement piece, the ticketing piece, the fining piece, the prosecutions. So I think that's sort of a question for 2021. But I mean, I really don't know sort of as much in the dark as anyone in terms of what's actually on deck. But I can certainly say that there's a lot of demands from worker advocates around those workplace safety precautions that they feel have yet to be met, both by, a lot of the health units and provincial and federal authorities, to be honest.
You know what? I will ask this because I am a bar and restaurant person and they are shut down.
Sure.
Where are they on the list of the industries?
Yeah, that one was interesting. For Toronto, bars and restaurants had the second highest number of outbreaks, but very distant second. So the sector with the highest number of outbreaks were warehouses, shipping, manufacturing, with 132 outbreaks since the start of the pandemic. And then bars and retail were second on that list with 41 outbreaks. So big gap in numbers there, but they were high up on the list. I think it's important, again, to put that in context of what kind of businesses operate in Toronto. A lot of the manufacturing and warehousing happens outside of Toronto in Peel region, York region. So it's not really surprising that for Toronto, bars and restaurants are quite high up there on the list. But yeah, really dwarfed by the numbers that we're seeing in that more industrial type setting.
Sara, I'm really, really glad that you joined us today and have been following the story from the beginning of the pandemic. I really, really want to thank you for your time.
Thanks for having me.
Sara Mojtehedzadeh is the Star's work and wealth reporter. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Sara Mojtehedzadeh. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.